are going to demonstrate how to give blood pressure and give a little bit of the background on how to do the technique, but also talk about some things that are commonly done wrong. So the first thing that you need to do is to kind of tell your patient about what's going to happen.
So I'm going to take your blood pressure. We're going to put the cuff on. I'll inflate it and you'll feel a squeeze, but it won't be for very long, so don't worry about it.
So after you give kind of just the general, make sure that when you put the cuff on, that the patient's arm is kind of in a relaxed, neutral position, so that way she's not tense or not over-stressed, I suppose. So then you'll put the cuff on and make sure that you line the cuff up with the actual artery, so that way you get the most accurate reading. And the cuff does have arrows that shows where it needs to go. And so once you get the cuff on, just get all of your dials and gadgets placed in a place that you can read them. Once you have the stethoscope placed in your ear, find the artery. So you're going to kind of just put it right underneath a little bit of the cuff, so just like that. Make sure that the dial, when you start to inflate the cuff, is not turned all the way so that it is completely tight so that you can't get it open with one hand. Make sure that you're able to turn it with your finger so that you have your hands as free as possible. Once you have this done, start to inflate the cuff and go to about 140 to 160 just to be safe. And once you get there, slowly start to release the dial. The first sound that you will hear is going to be your systolic pressure, which is the sound is the Korsakoff sound. So once you hear that, make sure you keep that number in mind and then deflate the cuff until you hear no sound at all, and that will be your diastolic blood pressure. These two numbers need to be even numbers just because blood pressure is measured in even numbers, and the normal blood pressure is about 120 over 80 millimeters of mercury. Once you have completed the blood pressure, inflate the cuff and take the cuff off the patient and kind of give them a little bit of background on what results you found.
Good job. Your blood pressure was 110 over 70.
So some common mistakes that are often done, especially by people first learning how to give blood pressure, begins with using the wrong cuff size. So as you can see, this cuff is way too big for Emily, and this will actually really mess up your blood pressure reading. So if you have too big of a cuff, the reading is going to be too low, but if the cuff is too small, it's actually going to be a higher blood pressure. So you're just going to want to make sure that you use the right cuff.
I would just go with the adult size one.
The next mistake that a lot of students and or professionals do is putting the cuff inside out. So this won't help you at all because it's going to actually inflate the wrong way, and you won't have any reading because it is not doing what it needs to do, as you can see. Along with the cuff and how you place it, you want to make sure that it actually lines up with the artery that you're using. And usually on the cuff it does have a little arrow telling you where the cuff needs to be. And so just make sure you're doing that, because if you don't get it right there, then your reading is going to be kind of messed up. So the next part that a lot of people do wrong is having the earpiece of the stethoscope in wrong. So you really want to make sure that you point it inwards so that you get the most accurate reading. But a common mistake is to have it pointed outward or towards the back, and that is just not really going to let you get an accurate reading because you won't really be able to hear anything. Another really important part is to have your patient or subject have their arm in a very relaxed, neutral position. You don't want them to be, completely at a 90-degree angle, otherwise it's not really going to give you what you want, but you also don't want them to be like sprawled out and super, just like almost too relaxed, I suppose. And the final thing that a lot of people do is either letting the air out too quickly or not quickly enough. So when you let the air out, you want to do it slow enough that you're able to read all of the numbers, but you don't want to let it out too quickly, otherwise you're not going to be able to hear anything. On the flip side, you don't want to let it out too slow that the patient starts to go numb because you have cut off her blood supply to her arm for too long. So just make sure that you don't air up the cuff too tight either, because otherwise that could just cause some uncomfortableness for your patient.